Morning guys, just en route to an IMG Careers event in London. I look forward to seeing some of you guys here. It's a bit of a rainy day, but hopefully it'll get better. I want to talk a little bit about compliance issues in role play scenarios that you may be doing for a medical exam. So when may compliance be an issue in a scenario? And think about it in chronic disease scenarios where people have been taking medication for a long time. We can't just assume that they're taking their medication. We should be asking about it. Think about when people talk about problems with medications, like, I don't like medications, doctor, or there's a lot of side effects, doctor, or there's a medication for everything these days, doctor. You've got to think about asking about compliance, because it could be a core issue in that scenario. But why do people not take medications? We all think about side effects, of course. We must think that's the reason why this person's not taking their tablets, because they're getting loads of side effects, and before you know it, you can go talking about side effects for 3 or 4 minutes, and actually that's not an issue at all. Or it might be side effects, but it might not be that they're actually getting side effects. Maybe it's a fear of side effects. Maybe there's someone in their family who've had this medication before, it caused lots of problems, and therefore the fear of the side effects is stopping them from taking their medication. But there are lots of other reasons why people may not take medication. Maybe they're denying their condition. Maybe they've got a condition and we know it's proved on tests or whatever it might be, but the patient doesn't believe that. They deny they've got it. So why would they take medications for something that they don't think they've got? So maybe that may be stopping them from taking medications. Maybe they may have a condition that is a silent condition, something like diabetes, something like hypertension, and because they're not getting any symptoms or any problems, maybe they don't believe they should be taking medication. Sometimes people see medications as a cure for something, a symptom or a problem. So if you can't see that actual benefit, then why would we take it? Sometimes there are other fears about medications, things like, I don't want to get addicted to medications. This is a medication that people take for years, doctor. What if I get addicted to it? I don't want that to happen. So there may be underlying reasons why people's compliance is low, and it's not just about side effects. And one thing I see quite a lot when we do role play scenarios with compliance issues is that straight away, for some reason, our brain thinks there must be a side effect problem, and that's what we try and tackle, and we realize actually later in the case there's other reasons why they're not taking medications in the first place. When it comes to the second half, it's all about negotiating. You're not always going to get exactly what you want. Sometimes you've got to realize these are competent people. They can make decisions about their own health, but we can start to negotiate, maybe reduce doses or have a trial period or change to something slightly different that does the same job. But we've got to be used to picking up compliance issues in the first place and then negotiating a plan in the second place in the second half. Much more like this on our courses, our webinars, especially our day courses, and our audio training as well. #CanPassWillPass, #I went with Arora. See some of you in a few hours.